Hello everyone. Today we're back again, me and my friend Tereishang.
Hi.
So we are both psychologists, and today we want to take this opportunity to talk about mental health because today is World Mental Health Day, and the theme for this year is making mental health and mental well-being for all a global priority. So more or less, it means making mental health accessible and affordable to all. So we're here to shed some light on the importance of mental health and how to take care of your own mental health. This is especially crucial after the post-pandemic because we all know what we have gone through. A lot of us struggled, and some of us have come out of it, but some of us are still, struggling, not only in terms of physical or financial loss, but today especially talking about mental health. In terms of mental health, the struggles were real. We know this because we're practicing in hospital, and we know how the surge of patients are after post pandemic. And it's sad to know that a lot of people do not even know that they are suffering from issues such as breathlessness or excessive worry or excessive fear or feeling of choking or other symptoms of anxiety, which actually they come to know that these are actually anxiety symptoms only after coming forward and taking help from professionals. So some of us are still, or some of you might still be suffering from it in silence, and some of you do not even know that these are actually something that requires medical attention or psychological intervention.
I think most of it are left unrecognized.
Yeah, you're right. So it's very important that we openly speak and talk about mental health and try to normalize talking about mental health. Obviously not normalizing mental health, but talking about mental health, openly speaking about it, because I believe that's the first step to spread an awareness. Because we should make it as normal as something like physical health. It's equally important like physical health.
Yes,
So it's
awareness will come when you start discussing, you start opening up and start having conversation about the difficulties, the issues that you go through. So this has to be normalized. It's about normalizing the
normalizing talking about it.
Normalizing talking about it, discussing about it, and opening up about your problems.
Otherwise, sometimes if early intervention is not done, then it can lead to severe mental disorders or psychiatric disorders, such as there are a lot of anxiety disorders like OCD, or mixed anxiety depression, or as simple as no, let's not call it simple. Any mental illness is not simple, but inability to cope with your daily stresses of life, leading to anxiety or leading to depression. So it's very necessary that we talk about it and we seek mental health at the right time and also from the right people.
Yeah, exactly. And also a lot of the time mental health issues are equated with psychotic disorders. So you can
so psychotic. It has been long, when we talk about mental disorder, people always think, or even I myself used to think, that it's always about suffering from psychotic disorders or psychosis, like having hallucinations, which is hearing voices when no other people are there around you, external voices, like you feel like someone is talking to you, or delusions when you have firm, unshakable belief about something that is not actually true, false, unshakable beliefs. So people equated mental disorder just with psychotic disorders, but the truth is there are a lot of psychiatric disorders, such as, like I mentioned, severe depression, which is also called sometimes major depression, or not very common, but is kind of prevalent, eating disorders, or seasonal affective disorders, which is also another mood disorder, which happens around some time of the year or some season of the year. Like some people might have depression coming back again and again during the winters only or during the summers only, or something like substance use disorders. So getting mental health treatment or intervention at the right time is very important. Otherwise, it leads to severe mental disorders.
It can develop into something more severe, right? And even into psychosis.
Yes.
So,
And yes.
Yeah, so like Mercy mentioned, so when we say psychosis, when we say psychotic, it means the presence of delusions, hallucinations.
Delusions, hallucinations, and other, I don't know if I should go technical into it, negative symptoms like blunt affect means, no expression, or not able to feel emotions, and other, thought disorders like, I don't know if I should get into the technical.
I think, we can do that another
Yeah,
time.
we'll do that another.
But that's when you really need a clinical attention.
Like, I would say safely that a mild depression, when a person has some amount of depression, low mood, and low energy, decreased concentration, forgetfulness, and other bodily or somatic, or what we call bodily symptoms like body complaints, like my head is paining, my back is paining, and all these things in a mild form, then yes, you can say that somehow by just a low dose of medicine with behavior modification or lifestyle modification can help you. But other things like anxiety, panic attacks, OCD, severe depression, substance use disorders, eating disorders, and personality disorders, all this requires medical attention and a thorough professional intervention. So shouldn't take it lightly. And should we go to the questions?
Yes.
Yesterday, we also took up some questions that.
Before that, I think we should be sharing something about the prevalence.
Oh yeah. Prevalence of mental illness. Would you be sharing in terms of globally or only in India?
I think I'll go both. So first, I start with the global prevalence of mental health issues in the world. So according to World Health Organization, 1 in every 8 people live with mental disorders. And research done in 2020 shows that the rate of people with anxiety and depression has been raised to 26% and 28% respectively. And India, according to research done recently in 2016, India is one of the highest prevalence of mental issues, and 56 million Indians suffer from depression, and then 38 million suffer from anxiety disorder. So every year 2 lakhs Indian lose their lives, they give up their life, so they die of suicide. Okay, yeah. And the Indian Psychiatric Society reported that reported a rise of 20% in mental illness cases since the beginning of the pandemic. So it shows that this COVID-19 pandemic has a lot of negative impact on mental health. And people have been going through a lot of struggles, like you have mentioned before, that many people who have never faced any let's say severe mental issues, they also have been experiencing, and a lot of symptoms have been developing which they're not even aware of. And the sad thing is, despite this high prevalence in India, high prevalence of this common mental disorders like anxiety, depression, many of these illnesses are unrecognized, untreated, and have been left undiscussed also. Alright, so there's a lot of lack of discussion. This is according to research, lack of discussion and lack of recognition in our country regarding mental health issues. And I encourage every one of you, if you have any struggles that you feel is related to your mental health, then feel free to reach out to anybody. It could be your friend, your close ones, colleagues, or whoever. Just share with them. Start with that. Start discussing. Talk about it. That's how we spread awareness about the issues, because the issue that you face might be very different from the issues that another person faces. So that's how you educate one another. That's how you bring awareness among your peers, your groups, your society, about what kind of issues we are facing at this time, because it's increasing every year. And the sad part is that when a person who's facing mental health issues, we are very reluctant about going out and reaching out for help. But when it comes to physical issues, there is no stigma attached to it. Whether it is let's say diabetes or cancer or anything, you go to the hospital, you go reach out to the doctors, to the medical professionals, right? But when it comes to mental health, we have this stereotype that it is less important, and then we don't want to consider it as equally important as physical health. We take less care, we neglect it, and we hardly reach out for professional help. But mental health is as important as physical health, and it should be taken care of, because like you've mentioned, like Mercy have mentioned before, that if you don't get the right professional help or right treatment at the right time, it can develop into severe other mental health disorders. So I think this should all start from us itself,
from the community,
from us as an individual, and then share, talk about it. Feel free to talk about what you're going through openly. You don't have to be embarrassed, or you don't have to have a second thought about sharing.
So I'll just cut you there. So the person who talks about it, okay, we encourage a person to talk about it, but the person who hears them out, they should also be open enough, compassionate enough, empathetic enough to listen to the people who open up to them. Try and inculcate these non-judgmental attitude, which we were all trained to be, but then for non-professionals it's kind of hard. But I think I want to encourage people to be more compassionate, more kind to people who are suffering, your near and dear ones. I think that's the first step where you can do
just listening. Listening is the simplest and most effective thing that we can way of helping.
Like you say, it's a most effective way of helping, and it's the most simplest way of helping. And this is something, as simple as that, okay? But even in our practice, even in our clinical practice, listening is our major tool.
Yes.
We just sit like that, although we do a lot of reflection and all, but we practice not to talk when our clients speak, when our patients speak. So it's a very much important aspect of spreading and being aware about mental health,
and I think,
be able to listen.
And I think most of us underestimate the importance of listening, because we think that, how can you help somebody by just listening? But once you start doing it, it's not easy. Listening is not an easy.
It's not easy at all.
Like
I keep interrupting you right
very,
now.
But it's very important, and then once you start doing it, you'll understand the importance of it, the effectiveness of it, and that's how you can help.
Listening, it's even more effective than giving advice.
Exactly,
And because all we need, because see, human beings, we all have our solutions in our hands. It's just that we don't do it. Okay. So when we go out and reach out to someone, it's just that we want that person to listen to us. Unless we are asking for advice. When we want advice, we are clear about it.
We ask, what should I do?
What should I do? But unless a person asks you, what should I do? Don't give her unsolicited advice.
And I think most of the time we don't go to another person to seek advice. We just want them to listen. We just want to vent our emotions. For example, I come to you, just share my emotions, and I feel so light about it after that, after sharing my problems.
Imagine someone coming with so much of a heavy heart, and then telling you, venting his or her emotions, and you start telling that, do this, do that, do that. You start giving solutions.
that's
You
not
will chase the person away.
that's
you know?
not what they are looking for actually. They just want to throw out their emotions, vent their emotions, and that just makes, it's just like the transferring of energy.
Yeah. So we are taught a lot about how to listen. So be like a blank state. Take it in what the patient's telling you, but at the same time, okay, be ready to give your suggestions, your guidance when they ask you for it.
But it's not necessary.
Yeah, it's not necessary. Yes, that's a like in terms of our practice, I think we are going away from what we are supposed to.
I just want to add about caregivers also.
Caregiver
Because when we
burden,
talk about when we talk about people going through mental health challenges or difficulties, we mostly neglect the person who's taking care of that people, right? That individual. So most of the time we neglect the mental health of caregivers, but it's very important to understand that caregivers also face stigmas. They also go through a lot of stress, depressions, because it's very challenging to take care of somebody who's going through mental health issues. Because let's talk about caregivers of people or individual who's going through physical health issues. We can see it vividly, right? It's showing that okay, this person is not well, this person is not ill. But when it comes to people with mental health issues, it's not visible always outside.
The person might look really fit, might look well, but inside he's not able to perform the basic needs, the basic self-care. Then the person is totally dependent on the mother or the father. So this creates a lot of
we don't
stress.
see it on the external how dependent or what kind of struggle the particular individual is going through. So we don't see the difficulties that the caregiver is facing. So we should also be very aware of this, alert of this, and
so be non-judgmental, even in our day-to-day,
more empathetic to the caregivers around, the families of anyone who's going through mental health issues. So these are things that we should be very aware, very empathetic.
You're right. I'm glad that you brought that up. Good thing. There is also a lot of research on caregiver burden, especially in terms of schizophrenia. The caregiver burden is really high in terms of OCD, where the caregiver has to give in to the demands of the OCD person. I'm sorry to say OCD person, the person suffering with OCD, they would say that I need this particular thing to be this way. Then the caregiver would have to give in to that, and in that way, the symptoms is being maintained. He doesn't get better.
And they might face a lot of judgment, criticism. And I myself have been a caregiver of dementia, so I know how it is.
I remember. It's sad. I'm sorry to hear about her loss.
That's okay.